Hello and welcome. Today we're diving deep into a common yet potentially serious eye condition, viral keratitis. This inflammation of the cornea, the clear front part of your eye, is caused by a viral infection. Understanding viral keratitis, its causes, symptoms, and treatment is crucial for protecting your vision. So, let's begin. The primary culprit behind viral keratitis is the herpes simplex virus, or HSV, the same virus that causes cold sores. It's often referred to as herpes simplex keratitis, or HA-Zoster virus, or VZV, the virus responsible for chickenpox and shingles. Can also cause a specific type keratitis called herpes zoster ophthalmicus, or HZO. Adenoviruses, responsible for the common cold and conjunctivitis, can sometimes lead to a milder form of keratitis as well. These viruses can reach the cornea through direct contact, often after an initial infection elsewhere in the body. Okay, let's break down how these viruses attack the cornea. When HSV or VZV infect the cornea, they replicate within the cells, causing damage and inflammation. This inflammation can manifest in different ways, depending on the specific viral strain and the depth of corneal involvement. Superficial infections mainly affect the outer layer, the epithelium, leading to small, branching ulcers. Deeper infections can affect the stroma, the middle layer of the cornea, resulting in more significant scarring and vision impairment. The body's immune response to the virus also contributes to the inflammation and damage. Viral keratitis is a fairly common ocular infection. HSV keratitis is one of the leading causes of corneal blindness in developed countries. Studies estimate that hundreds of thousands of new and recurrent cases occur each year globally. HZO, associated with shingles, is also relatively frequent, particularly in older adults. The incidence of adenoviral keratitis is often linked to outbreaks of adenoviral conjunctivitis, especially in crowded settings like schools or daycare centers. The symptoms of viral keratitis can vary depending on the severity and type of infection. Common symptoms include eye pain, redness, blurred vision, sensitivity to light, excessive tearing, and a feeling like something is in your eye. In the case of HZO, you might experience a painful rash on your forehead or around your eye, sometimes preceding the eye symptoms. Recurrent episodes are also common with HSV keratitis and can present with similar symptoms, but can sometimes be less severe. Diagnosing viral keratitis typically involves a thorough eye examination by an ophthalmologist or optometrist. A slit lamp microscope is used to closely examine the cornea for characteristic signs like dendritic ulcers in HSV keratitis or pseudodendrites in HZO. Corneal sensitivity may be tested. In some cases, a corneal scraping might be taken to test for the presence of the virus through techniques like PCR, or polymerase chain reaction, or viral cultures. This confirms the diagnosis and helps determine the specific virus causing the infection. Viral keratitis can be classified based on the causative virus and the depth of corneal involvement. In the case of HSV, we have epithelial keratitis, affecting the surface layer, stromal keratitis, affecting the deeper layer, and endotheliitis, affecting the innermost layer. Herpes zoster ophthalmicus, caused by VZV, is characterized by its association with shingles. Adenoviral keratitis often presents as a milder, superficial form and can be linked to conjunctivitis. Treatment for viral keratitis focuses on reducing the viral load and minimizing inflammation. Antiviral medications, such as topical eye drops like ganciclovir or trifluridine, and oral antivirals like aciclovir or valacyclovir, are commonly prescribed. Corticosteroid eye drops might be used to reduce inflammation, but they must be used with caution and under close supervision, as they can potentially worsen the infection if not managed properly. In severe cases, corneal transplant surgery might be necessary to restore vision if significant scarring has occurred. While completely preventing viral infections can be challenging, there are steps you can take to minimize your risk of viral keratitis. Avoid touching your eyes, especially if you have a cold sore or shingles. Practice good hygiene by washing your hands frequently. If you wear contact lenses, clean and disinfect them properly and avoid overwearing them. If you have a history of HSV or VZV infections, talk to your doctor about preventative antiviral medications, which can help reduce the frequency of recurrences. Keeping your immune system strong through a healthy lifestyle can also help. The prognosis for viral keratitis varies depending on the severity and promptness of treatment. With timely diagnosis and treatment, most cases of epithelial keratitis resolve without lasting vision loss. However, stromal keratitis can lead to corneal scarring and reduced vision. Recurrent infections are common with HSV keratitis and can progressively damage the cornea over time. Recent research focuses on developing more effective antiviral medications and exploring new therapies to reduce corneal scarring and inflammation. Gene therapy and immunomodulatory agents are also being investigated as potential future treatments for viral keratitis.